Welcome to this week's edition of Endocrinology Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. A groundbreaking cardiac intervention was performed on a 79-year-old woman with acromegaly and multiple cardiac complications. The procedure combined PCI, alcohol septal ablation, and mitral tear. Post-procedure, her mitral regurgitation and left ventricular outflow tract gradient showed significant improvement. She was discharged just 2 days later with a favorable outcome. Esteve has acquired Caprelsa, vandetanib, a treatment for symptomatic medullary thyroid cancer in patients aged 5 and above. The acquisition, covering over 50 countries, aligns with Esteve's focus on rare diseases and expands its onco-endocrinology portfolio. In Malaysia, Biocon Biologics celebrates a milestone: 100 million insulin cartridges produced, serving over 345,000 patients. Their Johor facility is now the first and largest integrated insulin production site in the country, exemplifying a successful public-private healthcare partnership. In biosimilars, Biocon and mAbxience received European Commission approval for their denosumab biosimilars. Biocon's Vevzuo and Evifraxy, along with mAbxience's Genprex and Azambi, target osteoporosis and cancer-related bone loss. These approvals aim to improve accessibility and reduce treatment costs. In South Korea, Samsung Bioepis and Hanmi have launched Obodens, a biosimilar to Prolia, at a 13% reduced price. Supported by robust Phase 3 data and approvals from both the FDA and European Commission, this initiative is expected to enhance osteoporosis care for postmenopausal women. Scotland's Medicines Consortium has approved Eladinos, abaloperitide, for postmenopausal women at very high risk of fractures. This move brings Scotland in alignment with NHS approvals across England, Wales, and Northern Ireland. Medimaps has launched the TBS Osteo Advanced software across Europe. This AI-powered tool enhances fracture risk assessment beyond bone mineral density alone. It offers centralized diagnostics and is backed by over 1,400 peer-reviewed studies and more than 30 clinical guidelines. AI continues to revolutionize diabetes care. A recent study on the INCDSS AI system shows it performs comparably to physician-led insulin management in hospitalized patients with type 2 diabetes. It maintained glucose control with no safety concerns and showed potential for insulin dose optimization. In type 2 diabetes treatment, Icosema has demonstrated superior glycemic control and weight loss in a Phase 3 trial. Patients saw an average HbA1c reduction of 1.55% and lost 5.6 kilograms. The treatment also reduced hypoglycemia events and insulin requirements, offering a compelling once-weekly option for those with poor control. New insights are emerging around type 1 diabetes linked to pregnancy. Fulminant and slowly progressive forms may develop during or after gestation, especially in individuals with autoantibodies or specific HLA haplotypes. This underscores the importance of early diagnosis and close monitoring in women with prior gestational diabetes. Sanofi's Cield is being studied in a long-term, real-world observational trial among individuals with stage 2 type 1 diabetes. The focus is on safety and sustained benefit, potentially supporting its broader use in delaying insulin dependence. Eli Lilly's oral GLP-1 receptor agonist, orforglipron, continues to show promise in Phase 3 trials. Preliminary data suggest it outperforms dapagliflozin, offering a once-daily oral alternative to injectable therapies. This candidate may meet rising demand for non-injectable diabetes treatments. And finally, a new study sheds light on immunological and viral triggers for fulminant type 1 diabetes during pregnancy. Findings suggest that immunosuppression in the third trimester and postpartum immune shifts contribute to disease onset, especially in genetically predisposed individuals. Stay ahead in endocrinology research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.